We are live with the Crittenden County Coronavirus Weekly Update, if you will. This is sponsored today by Tom Potter, your local State Farm agent. Tom Potter's office is on Gum Street in Marion, and State Farm is the largest provider of auto, property, and casualty insurance in the United States. Tom is manning the phones. He's in the office, and if you need something, give them a call right now or anytime during business hours, 965-2284. Today we have panelists, a new set of panelists today. We appreciate them being here. And no, they are not practicing social distancing because of our studio is cramped, but we've sprayed them each down with Lysol, and they have been told to turn away if they need to sneeze or cough. They will get up and leave the set. So we have with us Joey Jones on the left here. Left it on your screen. Joey's a physician's assistant at the emergency room at Crittenden Community Hospital. And in the center is Leslea Barnes. She's a UK extension agent for 4-H. And to your right is Mayor Jared Byford, the City of Marion mayor. And we're going to discuss a variety of topics today. I will first let you know that, just a quick update, that the third negative test has come back in Crittenden County, came back this morning. So 7 people in total have been tested, and 3 have come back negative. The other 4 are outstanding. So we will begin with that and talk to Joey Jones, who works at the hospital in the emergency room. Joey, tell us what exactly is the protocol for testing here in Crittenden County. Is it the same all over the country?
So basically, we're still following both CDC guidelines and also the Kentucky public health guidelines as far as coronavirus testing. Basically, if you read anything on the website, you know the first thing that you do is, you want to call a number first. And that's usually 1-800-722-5725, and they will begin giving you the information that you need to know. If you are truly sick, and that is fever, cough, shortness of breath, what we're asking the public to do is to call their primary provider or call the emergency room at the hospital and let us give you direction, okay? Do not just show up at the doctor's office or at the hospital, because again, there's the risk of, spreading that to someone else. What we would normally do is we would advise you to either seek, individual testing or come to the emergency room. Again, if your symptoms are bad, we're not going to turn you away. We would bring you in, and we would, again, look for other sources of infection, because you have to understand we're still in flu season. We're still seeing strep, mono, pneumonia, other things that can cause respiratory symptoms. So basically what we'd like to do is, if we bring you in, we'd like to do those tests first, because again, we know that the coronavirus testing is a send-out test. If it's an emergent case, the state has told us that they can do emergent cases that will still take 2 to 3 days to get results. And then if we do outpatient lab testing, it will take up to 8 days to get a result.
What would be a situation that might dictate an emergent case?
Again, emergent case is those patients who are older, who have a compromised immune system, and they are exhibiting, again, high fevers, shortness of breath, chest pain. Any of those type of symptoms would kind of put up the red flag, and we would want to get those patients in and get them in for emergent testing. The other case is, of course, a healthcare provider. If we see a healthcare provider who is exhibiting some of those symptoms, high fever, cough, again, those people would be deemed emergent, because, we have a shortage of healthcare workers right now. We can't really afford to lose our doctors, nurses, and other healthcare workers. So they would also be deemed emergent.
Mm-hmm. Would that also extend to other first responders?
Absolutely. Okay. Again, shortage of paramedics, firemen, policemen, all those would fall into those categories.
Okay. Again, today's press conference is brought to you by Tom Potter, your local State Farm agent. You can get a hold of Tom. The doors may be shut to walk-in traffic right now, but he's still there and he's working. If you need to talk to Tom, the number is 965-2284 here in Marion, Kentucky. He's your State Farm agent. Speaking of agent, we have right here in the center, Agent Leslea Barnes, the 4-H agent in Crittenden County. Leslea, some pretty weighty stuff there from Joey, but we want to talk to you about how these kids can have fun right now. What are some things that 4-H or UK Extension Service is offering right now to get moms and dads some relief?
There you go. All right. So with this weather warming up, it's a great time to get outside and get active and enjoy the sunshine. So we've had to think of different ways to bring our programs and different things to the youth and to the families. So we've created some educational grab bags, packages that you can come behind our office, like most of the other places here in the county. We have locked our doors for public traffic, but we are not closed. Mm-hmm. We have our staff support there answering phone calls, and then an agent is there at least today to answer any questions that you might have. So we're putting together educational packs, or they might even be projects that you can work on for our county fair and state fair. We've had owl pellets out there where you can dissect an owl pellet. We've had some sprout houses.
An owl pellet. Let me circle back on that one. What are you doing with owl pellets?
An owl pellet is what the owl regurgitates back up. It is not vomit. The owls have 2 stomachs.
Joey's shaking his head.
Yeah, he knows about these owl pellets. So whenever an owl swallows their prey, which might be a mouse, or something like that. So they swallowed it. It all goes into that first stomach. What they need for their nutrition goes into their second stomach, just like ours. But the bones and the fur and things like that all stay in that first stomach, and they have to regurgitate that back out. So.
Hey, I'm a wildlife outdoors person. I did not know that. I think I may just stick with planting trees instead of owl
vomit.
Well,
I ordered some more owl pellets today, right before I got here. So we're hoping to put some more owl pellet kits back there because it is. I know a lot of people say ooh at first, but once you start getting in there, it's a lot of fun. So and I have a bone sorting chart so you can find out what kind of animal your owl swallows.
Oh, this is forensic type.
Then there you go. That's awesome. Right. So we're putting gardening kits together. I've had some projects for the fair. We're going to put some herb gardens together and things like that. So each week we're going to offer a couple things. And then also we've got our ag agent. She's still providing soil samples. And if you have any plant or pest problems, she's still able to, we can take those samples. They get collected a little bit different way. So we've got information also on our back porch about soil samples and the plant samples. And then our family and consumer science agent, she's been doing videos on cooking and healthy habits and things. So we're still trying to provide information, educational opportunities to everyone and still stay open. So
yeah, great opportunities there at the UK Extension Office. Mayor Byford, yes. Back to some little more weighty stuff, I assume. How is the city of Marion responding to this? And can you give us any insight into anything else that may be coming down the road that we may not be aware of?
Absolutely. We're marching right along. We're doing the taking direction from our governor, trying to follow suit as he suggests, which we've done that with the unfortunately the closing of the playgrounds and as of today the basketball courts
at the parks. What was the logic behind closing the basketball? Because it's an up close personal type game.
Yeah. Personal, yeah. Defense and everyone's the same touching the ball. So that was suggested. So we done that today.
Okay.
But as far as City Hall, we're business as usual. Just can't go inside the building. If you have an emergency, you can call City Hall at let's say it's 270-965-2266 in Layton, or City Hall Pam will direct your call to where you need to go, and you can use our drop box to pay your bills, and still there to help. So it's business as usual.
Let's go back just a second to the parks. We have 3 parks in the county. 2 of them are inside of the city. And what I'm seeing at the parks inside the city, I haven't been down to Riverview Park, but here in town, a great deal of traffic. Let's go back through. So what about the pavilions? I see a lot of people congregating in them. They're still open. There's no tape around them.
As of right now, they're still open. If we get word, we'll address that. But right now, use common sense. That's, your social distancing.
Uh-huh.
But as of right now, until we're directed further, they're still open. We want people to go out and enjoy the park. Just, again, use common sense and keep your distance and don't congregate.
And it's my understanding the restrooms at the Marion City County Park are closed. We know that, and I believe the one at Riverview Park is still open. Last I heard, I don't know if it's been closed. You may know something more.
I do not know
Yeah,
about
okay.
the Riverview Park.
Okay. But it is still open to camping. I assume so. All right, well, we're going to come back and visit with Joey Jones, but first I want to remind you that State Farm in Marion, Kentucky, your agent at State Farm is Tom Potter, and he is the partner for the Crittenden Press in today's Crittenden County News Conference. And I'm Chris Evans, the editor and publisher of the newspaper. And we do these news conferences every Friday at 3:30 until further notice as we go find our way going through this very unique situation here in Marion, Kentucky, and throughout the world. Joey, as the physician's assistant in the emergency room at Crittenden Community Hospital, I keep hearing about these isolation, negative pressure chambers. Can you explain, if someone comes in for a test, how they're isolated? Do they go into these negative pressure chambers?
Initially, no. Only if they actually have a documented case or if we're very concerned about a critically ill patient. We have 2 of those beds in the hospital. Basically, we're just going to take respiratory droplet precautions with anyone else who comes into the hospital, whether you come into the emergency room, the walk-in clinic, even if you're coming to do outpatient testing, just respiratory droplet precautions right now. Those 2 beds are reserved again for those patients who we have we feel pretty assured that they possibly might have coronavirus. Then yes, they would go directly into one of those negative pressure rooms. Again, that's just kind of protecting them, protecting us.
Well, it has to be very encouraging that we've had 7 individuals tested here, and everyone that we have results from so far are negative.
Yes.
That's reason to smile.
Yes. As of today, actually, we tested our 8th person today.
Okay. New information.
And again, if you think about the state of Kentucky, we have 248 cases of coronavirus. But a lot of people don't forget that we have 4.5 million people in the state of Kentucky. So the actual odds of contracting coronavirus are still very, very low. And we're still worried about those patients that come in with influenza, those patients that come in with pneumonia. Sometimes those are more critical patients than these patients that are potentially having coronavirus. So
that's from what I gather, watching national news and reading all the reports that I do. It's the overwhelming of the healthcare system is probably the scariest thing because it does put other people with health conditions at risk. Their risk factor goes ways up.
The good thing about Crittenden County, though, is, we have a small population that's kind of scattered out. If you're thinking about the cities of New York, San Francisco, LA, dense populations. Plus, these people do a lot of international travel. So they're more than likely going to be bringing in this type of illness. And again, with you have a densely populated area, yes, it can overwhelm the hospital system very quickly.
Of course, we're isolated to such a degree here. I believe it was Irving Cobb, the author from the late 1800s, early 1900s, actually grew up in McCracken County in Paducah, wrote at one point that at the end of the world he wanted to be in West Kentucky because everything always comes last to West Kentucky. Well, this is one time we're proud to be West Kentuckians. So how isolated or insulated do we? Can you quantify that? Put it any way?
Well, again, we are fortunate that in West Kentucky, and as far as Region 1, we've had a very small number of confirmed cases. We work together with emergency management for all of Western Kentucky. We're right now hooked up with something called WebEOC, which allows us to look at every hospital, how many beds they have, how many ventilators they have. So again, we're able to communicate. So if there was the chance that suddenly, all of a sudden, Crittenden County had 100 confirmed cases of coronavirus, they would not be, stuck here in Crittenden County. We would be able to, ship some of those patients to other hospitals where, again, they may have the capacity, have ventilators, have, intensive care units to take care of those patients.
I'll remind you again that today's news conference is brought to you by Tom Potter. He is your local State Farm agent, and they are in the office and working. Close to foot traffic, and you can call if you have anything particular. The phone number is 270-965-2284 here in Marion. That's Tom Potter, your State Farm agent. Leslea Barnes, the UK Extension agent. You were telling me, I ran into you at the park yesterday, and that's how you got hooked into this gig today. You told me so many great things that was going on with the extension and 4-H, but you mentioned pedometers. You tell us what happened there. You ran out? Or?
Yeah, so we get a lot of nutrition education things to give out to the public. So we had some pedometers in our closet, so we put those out on the back. So that helps encourage people to get out and get some exercise and enjoy the sunshine.
Did they last longer than the owl pellet?
They went quick. We asked for just one per person, and they were gone real quick.
So if you put a pedometer on it goes on your belt, right?
I think on your shoe.
On your shoe, okay. So, are those already? They're calculated and ready to go. I mean, you just put them on and go.
Yeah, there's a button you can push to reset it. So you just put it on and push the button so it clears back to 0 and count your steps.
How far should you walk? I know people use these step apps on their phone, and my wife does, but and I do some exercise and running myself, but I don't keep up with steps. How many steps should you take?
Well, I've got the Fitbit. I don't have it on right now, but it says 10,000 steps. So I'm not sure if that's what it's supposed to be right now. He's shaking his head.
10,000 steps a day. So how do we know how far that is in miles?
I do not.
That's a lot. Because I know I've looked at my app because it's on my phone, and I'll run 3 miles, and it's nowhere near 10,000 steps.
Well, yeah, I don't get 10,000 steps a lot of the days. So.
Yeah. Well, I know that's important, and I know, Joy, you should. I'm sure you'll shake your head on this, nod your head on this. Is right now it's important to be healthy.
Absolutely.
If you're healthy, your risk factor is way, way down there. So, here's an opportunity to visit the. Is it your Facebook page, Leslea?
Yes, Crittenden County Extension Service Facebook page. So we're getting a lot of new people that are liking our page, and we're sharing a lot of information. We're not trying to overwhelm anyone, but there is just so much information out there to share right now. So we're trying to just share a variety of information. I know even our ag agent shared about small businesses. I was kind of pointed towards the farmers market, but it's also for small businesses. So we just shared that today as well. So there's just not only information for youth, but also for adults.
Now you're doing a cooking show as well, a nutrition and cooking type show?
Yes, our family consumer
Is that
site.
on that same website?
It is. So you may have to scroll down a lot if you're looking for it. Also, our phone numbers are posted there, our emails and our cell phone numbers. So you may have to scroll down a lot before you find it, but all that information is there.
Okay. Mayor, one of the questions I've had from time to time or been involved in some meetings around the community, I get to go to a lot of those. There was some question like, is there any doomsday, I hate to even say that, the doomsday planning type strategies, but one of the ones that really struck me as interesting was the water plants. I mean, you have the people who run these water plants, they have to have a certain certification.
Yes.
A lot of training to be a water plant operator. So I'm sure, is there some kind of planning you go into if say 2 or 3 of those get sick? You don't have many of them anyway. You got to cover 24 hours a day.
Well, we are covered. We have it worked out with other water districts that some of theirs can come over and help us out in that situation. So we're covered there. And as far as water, we're contracted with Crittenden Livingston Water as well if we need their assistance on anything. So that part we have covered.
Now, you had a special call meeting yesterday, just some book housekeeping type things to get some stuff on the books. But it was interesting. That's the first time that the city had ever done a live YouTube. I assume the city administrator spent some time and set up a YouTube account.
He did. I think it took him quite a while to get that set up and going, but a little nerve-wracking at first. But we made it through it. It was real short, but we did. We passed 2 municipal orders. One was just pertaining the leave of employees concerning the coronavirus, and the other was suspending our regular meetings of City Council, going to the special meetings via YouTube Live. So
you're you will not have a normal third Monday of the month city council meeting.
No, sir.
Just you will meet as necessary. If
Yes, sir.
something
That is
comes
correct
up.
via the YouTube Live special call meeting.
I do know, and probably I don't think I have not written anything in a good while about this, but while school's out, I know there's some talk about doing some work over on Country Club Drive to prep that for some pavement. I'll let you talk a little bit about that.
That's good news, and that is actually moving forward, and they're starting the prep work next week. So hopefully before too long we'll have a smooth Country Club Drive again, and that'll make, I'm sure, the bus drivers happy and the commuters going back and forth to school happy. So
Yeah, without the school traffic there,
it's
you
gonna
can
make it
actually
easy.
get some stuff done
Absolutely,
over there.
that is good news. So.
And the state through some funding that you got back around in the last fall is going to pave this once you've made the base repairs.
Industrial Drive and Country Club Drive.
Yeah,
So,
yeah, I know a lot of people will be looking forward to that. There's some new news at the police department too.
Police department, yes, absolutely. We hired Donald Crawford on Wednesday, who's going to bring some experience to our team, and he can be on it, as soon as we need him. So I mean, I don't know if he starts next week or not. I'm not going to speak to that, but I know he doesn't have to go to academy, so that saves the city quite a bit of money and time. So.
And one other thing, I have had some questions. Some viewers have asked, and some of the readers online have asked about utilities, city utilities. This is a difficult time, and I know the government, in many cases, are giving people a little more leniency. Is there any program that you have going on right now at the city with water?
Well, we understand what's going on, and it's new to all of us, so we're not going to be shutting water off. For how long that goes on, I can't tell you that.
Yeah.
I don't know.
Yeah.
But it would be hard to sit here and preach, hygiene and wash your hands, and then we cut off your water. So that's not going to happen. But how long that goes, I can't tell.
It doesn't mean you're forgiven for that month's water bill, right?
Right. Right.
You'll
So,
have to catch that up.
yes, sir, but there's going to be some leniency there, and we'll work with you. So.
Yeah. Okay. Going forward, Joey, give us a couple of tips. We're going in conclusion here, a couple of tips that people can really use over the next couple of weeks as we get through. Hopefully, maybe the last stanza of this. I don't know.
Well, I'm an optimist, and I would like for people to be optimistic during this time. I know it has interrupted our schedules. I know even for my wife, who's a grandmother, has become a teacher here over the last couple of weeks, teaching grandkids. And I understand that for some of us, levels of stress could increase. I've heard, people having increased anxiety, depression, things like that. But I would say be optimistic. As far as the numbers are concerned, and again, the news every day gives us the worst case scenario and the worst case numbers.
Yeah.
And can I just share just a couple
Absolutely.
of numbers with you?
Sure.
Okay? So basically, we've had 92,000 cases of coronavirus in the United States out of, again, 327 million people.
Mm-hmm.
That is 0.02% of the population.
Yeah.
That's a very low number.
Can you send that information to the stock market?
Absolutely. I need to. I need my 401k to go back up. In 2019, we had 35 million cases of influenza, 34,000 deaths. So basically, 10% of the population in 2019 had influenza. So you see the comparison there. The 2009-2010 H1N1 flu. I was a part of the Crittenden Community Hospital at that time. Devastating. Really wreaked havoc among young people. I actually even had a 12-year-old girl that died in our emergency room from it. So horrific cases. And again, 61 million cases of H1N1. So see the numbers. Basically, the 1918 Spanish flu that we're hearing in the news. Right. 50 million people worldwide died from that flu. Yeah. So again, and we've just had 1,400 deaths. Yeah. So no cases in Crittenden County, and I want people to understand that. Right. No cases in Crittenden County.
Best news we have.
And basically, if we will use common sense, if we will do, as the governor has said, social distancing, keeping yourself in your home, around your family, limiting trips, good hand washing, all these things will I believe will keep us from having that pandemic strike this area. So, I just want to encourage people. That's what I want to do.
I like that message. Optimism is a force multiplier, as
Yes.
Colin Powell wrote in his memoirs. We need to respect this virus, but we don't
Absolutely.
need to let it get us down, particularly if we don't have it.
Absolutely.
Leslea Barnes, I don't want to put any additional pressure on you, but I just saw your mom and dad posted that they're watching. So,
Hi, Mom. Hi, Dad.
yeah. In conclusion, Miss 4-H leader, give me a couple of things that maybe moms and dads hadn't thought of, whoever's home taking care, maybe big sister or big brother is watching the little ones. Give me a couple of things. What can they do to occupy a couple of hours?
Well, I was thinking about this. I have a little boy who's 6 years old and in kindergarten, and so he was having to do some math today, and it's a pretty day, and I thought, why not get outside with that sidewalk chalk and do some of your homework on the sidewalk with your chalk, and just kind of think of creative things. I just want to really encourage people to get outdoors. Our homeschool club, they usually put up a story walk. We got a little delayed, but yesterday, a pretty day, we put that story walk out at the park. So, go out. The walking trail is still open. So go out there and walk around the trail, and you can read a story with your little ones. It's a pretty elementary story, but still a lot of fun and a good way to get out with your family. Remember to social distance and wash your hands when you get done, just in case. But
Well, that park is a central park, so to speak, central location right now. Very crowded all day. Mr. Mayor, and I know you've taken some precautions, some high touch points. You've got some caution tape up out there. What should people do? Just totally avoid those areas. It's not a go at your own risk.
Right.
It's stay off of.
Stay off of them, and while you can enjoy the parks, enjoy them. But we're taking it serious. Hopefully, everyone's taking it serious. If you do feel like you need to get out and go to the park, practice the social distancing. The other part was, enjoy this time with your family. Stay at home. There's a reason they want us to stay at home. Just enjoy your family. Watch one of the great services that they've been posting online. I've been enjoying those from all the different churches around the community. Those have been great. So
It's incredible how innovative we can become.
absolutely.
Yeah.
But we are taking it serious, so hopefully everyone will stay in. Well, don't stay in if you want to get outside, but only travel if you have to. So,
Absolutely. All right. Well, again, today's news conference has been brought to you by State Farm. State Farm is your largest provider of auto, property, and casualty insurance in the United States. Tom Potter is your local State Farm agent, and you can get a hold of Tom by calling the office at 270-965-2284 here in Marion, Kentucky, and they are answering the phones. And if you need business taken care of, you want to talk about a product or your insurance policy, give them a call. Tom Potter, your local State Farm agent. Thank you so much, Joey Jones, physician assistant at the emergency room at Crittenden Community Hospital. Leslea Barnes, our UK Extension 4-H agent, and Mayor Jared Byford. Thanks so much for being on our panel today, and we appreciate everyone watching. This has been a Crittenden Press news conference. Thank you.